So let's broaden this out by speaking to our guest via Zoom from the UK to discuss the possible areas of focus and fallout of the UN General Assembly, who is a General Practitioner and Clinical Director, Chapeltown Primary Care Network in Leeds, Dr. Abiye Hector Goma. Thank you so much for joining us on Word Now. It's said that Africa has the slowest vaccination rate of any continent, with some countries yet to start mass vaccination campaigns. The huge gap is in vaccine equity is not closing anywhere near fast enough. What would you say is responsible for this?
I think it's multifactorial. Thanks for having me on your program again. I think it's multifactorial. The first one is looking inwards at Africa, because as somebody once said, nobody can love you more than you love yourself. So when you look up and down Africa, the things you see are not quite encouraging. So we have not done very well. We're trying to build institutions around health, around anything really. So the outside world is not going to spoon feed us. It's what we are bringing to the table that will determine. So in terms of the leadership structures we have, the kind of governance we have in Africa, it makes it very difficult to be a big player unless you get your act, your house in order. And so far, the African nations, with all what nature has imbued, we haven't really been up to scratch with having our house in order. That's the first and foremost reason why we have a very small minority of Africans have had the vaccines. And then the second thing, of course, is that every nation, looking at the way we've been dealt with, from pre-colonial and post-colonial eras, most people want to see what they can get out of Africa. So the whole vaccine diplomacy, vaccine inequity, it's quite obvious that people will look after their own interests first before they look after the interests of Africans.
Well, that brings me to this question, because I'm not sure whether you have seen the story about the United Kingdom saying people who receive their COVID-19 vaccine in Africa, India and certain other places will be considered as unvaccinated. And the question is, isn't not the same, or was it not the same vaccine that we took together with the United Kingdom? Talk about Moderna, AstraZeneca, Pfizer. So why are they going in this direction?
Well, somebody once said that politics has been the main driver of action and inaction. And I think this is all political more than scientific. There is the diplomacy, like we mentioned. On the one hand, you have Russia and China, and you have the West on the other side, each one trying to woo both the low-income countries to try and follow their line. And I think bringing this kind of policy in is more or less saying, you better get our vaccines if you want to come into our countries. Because if you look at the data around the number of cases, worldwide, the number of deaths worldwide, it's not as if things are any worse than they are elsewhere. And then, for example, Nigeria has had the AZ vaccine, the Moderna vaccine. It's exactly the same vaccine that many Nigerians have had, which have come from the AZ laboratory. So I think it's more of a political decision to make African countries and other countries to say, look, you had better move towards our vaccines than going towards the Russian or Chinese vaccine. That's the way I see it.
Does this not call for African countries looking inward and producing their own vaccine, manufacturing their own vaccines? Even if they are not accepted in the West, they should be able to manufacture their own. But what would you say to this, if it makes sense to you in a way?
Oh, I mean, most certain, and it's not just vaccines. We've had malaria for forever. What inroads have we done to malaria, eradication or things like that? Most things happen when the West comes in to help us. And I think it may not have to be the COVID-19, but more than ever, Africans in the diaspora, Africans in Africa need to work together to see how we can solve our problems. But this perennial system of depending on some Santa or some Father Christmas to come and solve the problems of Africa, to give us vaccines free of charge, it's not going to get us anywhere. There's no mileage in that. We as Africans at home and abroad need to come together and find solutions to our problems.
Absolutely. So there will be about 150 people scheduled to address the General Assembly in person, because the past 18 months have proven that virtual diplomacy just doesn't cut it. Is that to say that the concept of virtual meetings, working from home, etc., considered to be gains from COVID-19, are no longer going to be fashionable post-pandemic?
Right. I mean, I know that COVAX, for example, means well in terms of coming together and having a global distribution of the COVID-19 vaccine. But I think the world is moving away from the donation of vaccines to being able to purchase your vaccine. So those countries that can bring money to the table and purchase their vaccines probably are going to come out better at the end of the UN General Assembly. Yeah,
so exactly what I tried to find out from you, because if people are now coming together, talking about the upcoming program, that the UNAJ that will be coming up tomorrow, and people are going to be gathering, does it mean, because they feel, the reason why they want to come together is because they feel that what they are doing virtually doesn't hold water, it's not really effective? Is that to say that it is not, some of the gains we recorded in COVID-19 during this COVID-19 pandemic are no longer going to be fashionable in the coming future? Because if these people are gathering, it means we have to go back to, the olden days when we used to come together.
I think a late popular Nigerian musician talked about United Nations and all that. At the end of the day, the people that have, the big players at the end of the day will have their way. We can have our say and make all the noise. But at the end of the day, the rich countries will end up doing what they want to do. Coming back to the COVID vaccine, I mean the WHO's Secretary General had said, rather than going into booster vaccines, that there's a kind of a catastrophic moral failure if the rich countries do not delay boosters and help the world, the poorer countries, to have more of those vaccines. But it just comes back to the fact that people will only help you after they have sorted themselves, and until they've sorted themselves, you cannot really legislate for the help that they will give you.
Absolutely. The Director, General Practitioner and Clinical Director, Chapeltown Primary Care Network in Leeds, Dr. Abiye Hector Goma, thank you so much for speaking with us on World Now.
Thank you.